Segment may contain sponsored content paid for by advertisers. The opinions and views expressed belong to their sponsors and not those of Nexstar Broadcasting Incorporated, this station, or their affiliates or employees. You're watching Central Illinois Newsday.
While COVID-19 vaccinations is ramping up in the U.S., there's still a critical need for treatments to help people who get infected with the virus. Experts say getting treated sooner after diagnosis gives people the best odds of avoiding severe disease or hospitalization. Here to talk about a treatment option is Janelle Sabo, the Global Therapeutics Platform Leader at Eli Lilly and Company. Doctor, thank you so much for joining us this afternoon.
I'm fantastic. Thanks for taking us and doing a recording today. I'm excited to talk to you about the COVID-19 therapeutics.
Well, first question for you. What are monoclonal antibody treatments and how are they administered?
Yeah, so for the last year at Eli Lilly and Company, we've been working on a new class of drugs called COVID-19 therapeutics. In this class is a set of drugs that are called neutralizing antibodies. What these antibodies do is attach to the virus and actually allow the body to quickly get rid of the virus. This means that the virus can quickly decrease in the amount in the human body, which allows a person to recover potentially a little bit faster. But most importantly, in those high-risk patients, it allows them to decrease their risk of hospitalization, emergency room visits, or even potentially death by up to 87%.
Sure. Now, who is eligible for these antibody treatments?
Yeah, so those that are above 65. But in addition to that, any individual ages 12 and above who have significant underlying medical conditions such as hypertension or cardiovascular disease, lung disease, or maybe overweight with a BMI of 35 or above would potentially be eligible. What's most important is that individuals who believe they may be at high risk from COVID-19 and potentially bad outcomes such as hospitalization or ER visits should have a discussion with their physician to see if it's right for them.
Dr. Sabo, how do these treatments differ from vaccines, which you talk about often?
It's a wonderful question, and particularly with vaccines in the news so much, I know it's a really common question among probably viewers in your area, but frankly across the country. So vaccines are used to actually prevent infection, whereas these therapeutics are actually used to treat the infection once somebody has actually contracted COVID-19. And so the difference really is that prevention, which is your vaccine, and people should definitely take vaccines if and when they're eligible, but should they contract the virus, then this is a treatment option for them.
All right, so let's play out a scenario, right? So you just received a positive COVID-19 test. So what are your next steps? What should you do?
Yeah, the very next step after you go through the emotions of getting COVID-19, sometimes it's sadness, frustration. You know, you may even be a little bit angry that you've ended up with the virus, and sometimes people are very afraid, is to pick up the phone and talk to your healthcare professional. It's really important to do that very quickly because these COVID-19 therapeutics are really most effective in that first 10 days after symptom onset. So having that conversation quickly with your healthcare professional to determine if they're right for you, if you're a high-risk patient, is an important next step right after you're positive.
And where can our viewers find COVID-19 antibody treatments that are near us?
Yeah, so it's a really important question. No matter where your viewers are located, they can go to combatcovid.hhs.gov. Scroll a little bit down the website, you'll find kind of a reddish pink button that says Find Treatments. If you click the button, there's an interactive map. You can add your address, say how far you're willing to travel, and it'll locate the center nearest you. But you're really lucky that there are several centers in and around your area. Two of those are Unity Point Health and St. Francis Medical Center, but of course there are others. So going to combatcovid.hhs.gov is a really great starting point for both physicians who are prescribing for their patients, but also for patients to locate infusion centers.
Why is it so important to receive treatment within 10 days of experiencing COVID-19 symptoms?
Yeah, a lot's been learned in the last year about COVID-19. And what we know is that these high-risk patients, in those very early days, if you can reduce the amount of virus that their body is having to battle, they recover a little bit quicker potentially. But most importantly, they can decrease the risk of hospitalization, emergency room visits, medically attended visits, or even potentially death by up to 87%. We know that if you go longer than that, then they're less effective. So really seeking treatment and having a conversation with your healthcare professional in that first 10-day window is really important.
And doctor, is there anything else you'd like to add while we have you here this afternoon?
No, I'm really grateful for the time today. I'm thrilled to be able to share this information with your viewers, and I hope in some way it helps them to know whether or not these treatments are appropriate for them and how to have the conversation with their healthcare professional. So I hope that you stay healthy. I hope you have a great rest of the week. Thank you so much.
Dr. Sabo, thank you so much for your time. For more on this interview, more information, head online to ciprown.com. We'll have all of that posted there for you.